Hello and welcome back. Dr. Shields again, and I'm going to continue with Chapter 9, Alterations in Immunity and Inflammation. Okay, so basically in this next section, we're going to talk about two things. We're going to talk about disorders of the immune system, basically kind of minor ones, allergies, and then extensive ones like an immune deficiency or autoimmune disease. So disorders of the immune system, complications arise when the immune system does not function properly. It could be minor, like an allergy. Like I said, that'll be one thing that we'll talk about, which could obviously become very serious. Or it can be extensive, meaning that something like cancer, the immune system isn't working, so somebody develops cancer. Genetic disorders that wipe out immune cells. Some examples, again, minor allergies, which we call hypersensitivities, and there's 4 types that we're going to talk about. And then extensive kind of some immune deficiencies, which is not common. It's rare, but it does occur. So people do have immune deficiencies. They don't have the ability to fight pathogens that enter their body. Autoimmune diseases, when the body just kind of starts fighting itself because it doesn't recognize itself, and there's plenty of autoimmune diseases that falls under that category as well. Sepsis due to a massive inflammatory response in cancer. So let's start out with hypersensitivity. Hypersensitivity, remember, is an abnormal response. We're talking about abnormal responses here. Disorders of the immune system. Body responds to a particular substance, an antigen, an allergen, in an exaggerated fashion. So something that is an exaggerated reaction that we shouldn't have when we come in contact with these antigens, or it does not happen in normal circumstances. Results in inflammation, destruction of healthy tissue, may be immediate, it might be an immediate response, or it can be a delayed response. There's 4 main types of reactions that can be produced by the immune system, and they are going to be type 1, which is IgE mediated. So kind of think about, again, when we talk about these IgE, IgG, IgM, they're immunoglobulins or they're antibodies in the body that are supposed to be fighting any pathogens or antigens that come into our body, but they have this abnormal reaction in these hypersensitivity reactions. So type 1, I'm going to elaborate on all of them. And IgE mediated, generally this is pretty quick, and an allergy or anaphylaxis is a perfect example of a type 1 hypersensitivity. Type 2 involves the IgG or the IgM. Cytotoxic, so toxic to the cells. They just attach themselves to the cells and cause cell destruction. It can take hours to days. And an example would be hemolytic anemia or like a blood transfusion reaction we'll see. So these antigens attach themselves to the cells and destroy the red blood cells. Type 3 is a complex, immune complex, and it's actually a complement activated. And basically what these are, these can occur in 1 to 3 weeks. And these are generally autoimmune disorders like lupus, an arthritis reaction from like a vaccine. And I'll talk a little bit more about that. And then type 4 doesn't have antibodies. It's T cell mediated. Can take days to weeks, so this is a delayed response, and generally like a rash from poison ivy or like a tuberculosis, when you get that antigen put underneath your skin, if it reacts, it takes days to react, so delayed response. So the response to the host to the presence of foreign substances can trigger 4 types of hypersensitivity reactions. Again, type 1, IgE mediated, there's an allergen. Surface IgE releases mediators, and when these mast cells and these mediators are released, because the allergen attaches itself to the surface IgE, and these surface IgEs just increase and they start reacting abnormally, these mediators are released and you get allergy symptoms, hay fever, food allergies, all the way to possibly anaphylaxis. So one thing I kind of do, it helps me remember them, is so type 1A, allergy anaphylaxis. Okay. Type 2 Tissue-specific, IgG or IgM. This is important to know up here. Remember when we talk about allergies, think IgE. That's an important thing, IgE, when we're talking about the immunoglobulins. And then tissue type 2, either the other two, the IgM or the IgG reaction with an antigen on the cell resulting in cell lysis, okay, like hemolytic anemia. Another example, a blood transfusion reaction is a perfect example. So IgG or IgM bind to the cell, and when it binds to that cell, it causes that cell injury that I just explained in the previous slide. So it causes cell injury to that site. And again, that's what happens in a blood transfusion reaction. These IgG or IgM will attach to the cell, the red blood cell bursts, and then somebody has a blood transfusion reaction. It could be fatal. I think it too being B, A, B for blood. Type 3, immune complex mediated. Antibody antigen complexes accumulate and become deposited in tissues, and these are generally autoimmune disorders. So what happens is these antigen and antibody complexes, right? That's what happens. There's an antigen that gets into the body, so the antibody attaches itself to it, and then it's supposed to be die, go away, and that's how the immune system fights. However, when the antigen and the antibody attach themselves in this abnormal reaction, these complexes just start accumulating abundantly in the bloodstream, and they start traveling around and they deposit themselves into the tissue. Most often these complexes, they get deposited in joints. You know that as like rheumatoid arthritis, and these complexes are just filling up the joints and causing all the symptoms of rheumatoid arthritis. They get deposited in vessels. That's not uncommon for them to go into vessels. It's a common spot. So somebody who has lupus will have symptoms like that because they start going into these complexes, get deposited in a vessel. Arthritis reaction from a vaccination, this complex starts getting deposited in the capillary and around that tissue, and they start having a reaction. So this is C for complex. And then number 4, cell-mediated, delayed processing in the antigen by macrophages. Delayed. Okay, this is a delayed response. Examples would be a TB test. We put the little TB test under the skin, and you have to come back 24 to 48 hours later to read it because it's a delayed response. Transplant reaction, which is a delayed response. Contact dermatitis, like poison ivy, you get exposed to it, but you don't have the reaction of the macrophages and the swelling and the itching and stuff until later. It's delayed. And this is not antibody involved. And again, this can take days. So I put D here for delayed, A, B, C, D. That kind of helps me keep track of them a little bit, just like a basic information. Well, let's elaborate a little bit more on hypersensitivity type 1, which is immediate, which are allergies. Body makes a hyper response to a foreign material. We could have a localized response with the itchy nose, runny nose, scratchy throat, hives, digestive issues, anything that comes along with that, or a systemic response as bad as an anaphylactic reaction or anaphylactic shock, which is a respiratory and circulatory collapse. So the body basically shuts down, it goes into shock, and somebody can certainly die from it. So allergens can respond overwhelmingly in the body, and then the person feels terrible. You can get a skin allergy test to determine what somebody's allergies are, what they are hypersensitive. See these hypersensitive reactions right here. We now can get draw blood and get the same information, but well, not the same information. For much of this, we can kind of look in it as with a blood draw, but this is a skin allergy test that is commonly done with somebody who has type 1 hypersensitivity, which are allergens. Type 2 hypersensitivity cytotoxic, remember, A for 1, this one is B, blood transfusion reaction, hemolytic anemia. So blood transfusion reaction, if you get the wrong blood type, the body responds strongly. And these are just the blood types that just for a review for you. They're determined by the protein that you have on your blood cell. And the four groups are group A, B, group A, group B, group AB, and group O. So O here is the universal donor, DOO, that's kind of how I remember it. So that's important to remember. And AB is the universal recipient, okay? And what happens here in group O, they have this blood cell, this is their red blood cell, and there are no antigens on the red blood cell. So antibodies that are in the blood are anti-B and anti-A. So they can receive any blood from anybody. Excuse me, I'm sorry, they can't receive anything. Not they can't receive it because they have antibodies. There's no antigen, so if somebody gets type O, there's no antigens here for their antibodies to fight against. That's why group O is the universal donor. Okay, see, there's nothing on this blood cell. It's an empty blood cell, so there's nobody has antibodies in their blood to fight it because there are no antigens. Group AB is the universal recipient, and so the antibodies, or excuse me, the antigens that they have A and B antigens, and that person has no antibodies in the plasma. And hence, since they have no antibodies in their plasma, because why would they? They have A and B antigens here, so they don't have any A or B antibodies to fight that. They'd be fighting their own blood cell. They can get any one of these blood types because they don't have antibodies. Then group B, somebody with blood type B has these B antigens on their red blood cells, and in their serum they have anti-A antibodies, so they can't have anything that has A antibodies on them because it would, antigens on it because it would fight it. And then group A, which is these A antigens on the blood cell, and then in their plasma, their antibodies are anti-B, so they can't have any B type of a blood that, or the body would fight it. But they could get this, right? They could get this because that's not going to fight that. So it's just kind of a little review. Okay, let's move on to type 3 hypersensitivity, which are autoimmune disorders. It's just an overactive immune system, and it's a complex reaction. Remember, this is the C, ABC. This is the C. I don't know why that's doing that. Autoimmune disorders, which can cause serious problems for people. Autoimmunity is when the body does not recognize itself, and it attacks the tissues and destroys it. So the antibodies are actually attacking the body because it doesn't recognize it. So these complexes are just going into getting deposited and attacking those tissues. So this is an example. So this is the basement membrane. This is a blood vessel. And number one, immune complexes are deposited in the wall at the blood vessel right here. So these immune complexes that are supposed to be getting eaten up and taken away are getting deposited because they're in such an abundance. The presence of immune complexes activate these complement proteins, and it attracts inflammatory cells like neutrophils to the site. So neutrophils come to the site, they release their enzymes like they're supposed to, and with all that inflammation, it causes damage to the endothelial cells inside the vessel. So it's kind of how those complexes cause damage inside the cell. So some examples here, serum sickness, which would be systemic, somebody who would be exposed to some type of serum, and more of this isn't as common as it used to be, but a more common type of serum sickness is called an Arthus reaction, and it's acute, localized, not a systemic response. But this type of a response, but it's localized inflammatory response, typically after a vaccination right here, causes swelling of the affected area, and it is a type 3 hypersensitivity reaction. Again, not uncommon with the vaccine, and this says rare, can result from a multiple repeated insect bites. That's possible, but rare. And generally within 24 hours, we see this reaction on the skin right here. Pathophysiology: interaction between injected antigens and circulating antibodies. They activate the complement cascade, which is part of an innate immune system, and then they get deposited into these areas like the vessels, and they get vasculitis near the injection site, like this person did right here because of the vaccine. Oh, and the Raynaud's, kind of the same thing. Raynaud's, the complexes get deposited in capillary beds in the circulatory system, generally peripherally. So it blocks the circulation peripherally, like in the hands, like in the fingers, and in the toes, and in the ears. So these complexes get deposited in the capillary beds. And so they have these fingers and toes and earlobes that are really pale and sometimes numb with some cyanosis. They need to be treated with vasodilators just to keep those little teeny capillaries open, because they can certainly have some problems with circulation. And that is also a type 3 hypersensitivity. And the last one, type 4 hypersensitivity, again, delayed. And delayed type reaction, because it takes 48 to 72 hours or longer for the reaction to develop, characterized by cell-mediated a T lymphocyte response, not an antibody. The other ones are all antibody, as in the other type of hypersensitivities. So these are immediate B lymphocytes. Okay, these are immediate. We just talked about allergies, blood transfusion reaction, complexes getting deposited in the joints and the vasculature, in autoimmune disorders 1, 2, 3, A, B, C, and then this is the fourth one. It's delayed. It's not immediate. T lymphocytes are involved, and somebody has a metal allergy. They put an earring in, but they don't have the reaction for another day or two later. Again, a tuberculosis test, the body doesn't respond for a couple days. A transplant rejection, poison ivy, those would all be examples. Okay, this next slide talks about desensitization, so allergy injection. So desensitization can be achieved in some people by getting these allergy injections. Could take years before they actually become desensitized. There's just a lot of different opinions as far as desensitization. And a risk factor is always anaphylaxis, that somebody would have a hypersensitivity response by injecting something that we know that they're allergic to. Blocking antibody action of a neutralizing antibody against human interleukin 6. So we can block the antibody, and blocking antibody binds instead of the kind of binds to it instead of binds to the antibody, instead of the antigen. So like, for example, sometimes people who have asthma and they have high IgEs, for example, high IgEs, and they can take a blocking antibody to neutralize the antibody against this response of this interleukin, which is going to cause them asthma symptoms and stuff. So these are some monoclonal antibodies that we can give somebody that could help with some allergy reactions. There's a lot of new drugs that are blocking antibody drugs for generally asthma that's caused by severe allergies. All right. Thank you. We'll come back with part 2.